Welcome to another episode in our series on COVID-19, Science in Context. I'm Stephen, and joining me today is Dr Anne Cori. Cases and hospitalisations in the UK have ticked up in recent weeks. Is this trend likely to continue, and what level could it reach?
So in most scenarios we have modelled, yes, cases, hospitalisations and even deaths continue to rise for a few weeks. But when and how high the peak is very hard to anticipate. This is because we still don't know exactly the extent of protection given by vaccination or by previous infection, or how long this protection lasts. In optimistic scenarios where protection is good and long-lasting, the peak is pretty much now at current level. But in pessimistic scenarios, the peak in hospitalizations is higher than in the last wave, although the peak in deaths is much lower thanks to the high coverage of vaccination. But this is all assuming no new variant of concern arises.
With many schools returning from holidays next week, what impact are we likely to see in COVID transmission?
I think we will see a combined effect of kids returning to school, but also adults going back to the office and mixing more indoors as we enter the autumn. All this is likely to contribute to an increase in transmission. But again, it's difficult to predict precisely the magnitude of that increase.
What do we know so far about waning immunity? And are we likely to need a vaccine booster program in the autumn or next year?
The level and duration of protection after infection or after vaccination is still not very well known. The good news is that some studies suggest that protection against severe disease is still high in many individuals months after their second dose. However, it is likely that a few people who are well protected will be less well protected in a few months' time. And this is why a UK booster program targeted at people with low antibody levels is being discussed. This targeted strategy would increase protection in those who need it in the UK, but also free up more doses for other countries. This approach would help to protect more people and would reduce the risk of other variants of concern emerging as well.
Thanks for your time.
Thank you.